Welcome to the Marvelous Middle Age Podcast, where we are building a community of people who are in the midst of midlife, sharing our stories and learning from each other along the way. Each week, I'll have a guest join me to discuss a topic that impacts our lives and touches on some aspect of midlife. We'll discuss relationships, transitions, health and well-being, parenting, careers, and more. My goal is to encourage and support you and help you thrive as you navigate this adventure of midlife. Join me here each week for the Marvelous Middle Age Podcast. This week on the Marvelous Middle Age Podcast, I'm joined by Dr. Tanya Teggatz. Dr. Teggatz practices functional medicine and medical acupuncture with a focus on menopause medicine to help women through the transition through perimenopause and into menopause. She graduated from the University of Iowa's Roy G. Carver's College of Medicine and graduated from the Cedar Rapids Medical Education Foundation's 3-year family practice residency. We're kicking off the menopause series by defining perimenopause and menopause and the common and not so common symptoms. We also talk generally about ways you can take care of yourself during this time. Stay tuned for the rest of this season to learn more about best practices for your well-being and health, addressing symptoms, hormone replacement therapy, and what you can do with all of this information. Dr. Tanya Teggatz, welcome to the Marvelous Middle Age Podcast.
Thank you. So happy to be here.
Well, I am happy you are here as well. We are sitting in your office practice surrounded by beautiful artwork, and I'm just so excited to be here. I've been in this office as a patient, and I hope to kind of, as we talk today, kind of share my experience and what that has been like going through that. I'm kind of at the beginning of the process, but I'm so excited about it. I'm so excited.
Yay.
But before we get into all of this wonderful content about perimenopause, could you just introduce yourself, share about yourself and your practice?
Sure. Well, I have been practicing medicine since 2000. Yeah, I think 2000 is when I graduated from my family practice residency, and I initially was a family practitioner, but for the past 10 years, I have been a functional medicine practitioner, and I also do medical acupuncture. I've been doing that for about 10 years as well. I opened the Teggatz Clinic 10 years ago. So the practice has morphed a little bit. Initially, I even did family practice with functional medicine, but for the past year or so, I have been focusing more on menopause medicine. I have found that that's an area of medicine that is, pretty lacking in people who are experts in it, who can help women through this transition from perimenopause into menopause. So, my new patients are mainly women who are going through perimenopause and menopause now, but then I also do functional medicine, which if, maybe some of your listeners aren't familiar with functional medicine, but
tell us
that is, functional medicine looks at the root cause of illness. So, we look at the body's different systems as very interrelated. The gut affects the brain, affects the hormones. They're not separate. And we place a big importance on gut health, nutrition, stress management, sleep. It's not all about medications, which, when I was doing family practice, a lot of it was managing
prescribing
medication. But with functional medicine, it's more actually about healing and optimizing your health and preventing illness more than managing illness.
Like responding to the illness and reactive. It's more proactive. How can we address different things going on that are all very much connected and do it in ways that promote healing and that sort of thing, as opposed to always. And like, as you said, not that medications aren't great and certain people need certain medications. Yep. And you do, but it's kind of also getting to the root cause maybe for some things and making some changes to address that. And that's one of the reasons I was really excited about becoming a patient of yours, is because of the, well, first of all, I mean, admittedly, the perimenopause was my first, I'm like, help. But also your approach with the functional medicine intrigued me as well. And so I'm just excited to learn more about, things I've got going on and address those things. And yeah, that's great. And I will put a link in the show notes to your website so people can learn more about what you're up to here, because I think it's great. Your staff is wonderful, and it's just been a great experience for me so far.
That's good to hear.
My first appointment, I felt like I just went on and on and on about all this stuff. And I know that's part of your protocol and how you do everything. But it just felt, I walked out of them like, geez, there's just a lot of stuff going on that you kind of forget, right? Because, and we've talked about this, I kind of Band-Aid things, right? You got something, I'm just going to do this, or I'll take this, or I'll, avoid that. But you don't ever find out why, the why behind things. So I love your approach, and I love what you're doing.
I find patients understand functional medicine, I think, more than Western trained doctors. It's just natural and common sense. Well, why did this happen? Whereas it's a different paradigm in traditional Western medicine, but patients get it. Yeah.
Right.
Why is this happening?
Well, and I think a lot of people want to know why. They want to know, gosh, why does my stomach hurt all the time? Or why do I have these headaches? Or why does this part of my body do this? Or why does it hurt? Or that sort of thing. And I think that sometimes that's not always explored in other types of practices or clinics. And again, I don't, there's nothing, you should absolutely get all your, preventive exams and go see your healthcare providers for all your things and symptoms and illnesses and stuff. But I think kind of alongside that, you can explore other facets of your health with a practice like yours that addresses other things and other approaches, that are interesting
I don't have the
too.
Same time constraints that a typical family practice.
Right.
Do I spend much more time with patients? And I have a different payment model.
Yeah.
I recently moved to a subscription-based payment model as well. And we could talk more about that later if you'd like. Or,
you can operate a little differently because you have some of that flexibility, and
which is wonderful,
which is awesome. Yeah, I know. I think I was in here at least, gosh, it was over an hour for sure that I think I was in here going on and on about all my stuff. And I was so blessed to get connected with you through a listener. So Elise Hexum, if you are listening, shout out to Elise. She connected me to you through her daughter who works with you. And I was also very fortunate to attend a presentation that you did not too long ago, talking about the very focus of this season about menopause and perimenopause and all of that. And so again, so thankful that you are willing to be a part of this and share all of the wonderful things that you know and ways to help. Before we kind of dive into the focus of this episode, can you just provide maybe a definition or overview of perimenopause and menopause? Sometimes I think those terms are kind of used interchangeably, but there's differences there. Can you kind of just define those for the listeners?
Well, let's just start with menopause. So menopause is defined as having no periods for 12 months. And really then for the rest of a woman's life, she is in menopause, which can be used, post-menopause is used interchangeably. So 12 months with no periods. Perimenopause is the 7 to 10 years leading up to menopause. And so when you think about ages, the average age of menopause in the United States is 52. But normal is considered between 45 and 55. So if normal menopause could start at 45, that means normal perimenopause could start at 35, which, seems quite young. Some women aren't even thinking about having kids until they're 35, but perfectly normal age 35 to be starting perimenopause.
And I will talk to people who are in their 30s and say, well, I don't need to worry about that till I'm in my 40s or 50s. I'm like, no, actually.
It's good to have a heads up.
You need to know.
And to know what's going to happen or may have already started.
Right. You might already be experiencing symptoms that you just aren't attributing to it, because there are so many, and everyone presents differently with different intensity of symptoms and combinations of symptoms, that you could be experiencing things that you just aren't even aware. And honestly, I wasn't aware until I started down this road of all of the different and sometimes strange symptoms that you can have. And so I would just encourage, if you are in your 30s, pay attention, start researching now, because a lot of people I've talked to, some of us were fortunate to have the talk, so we had the puberty talk with someone in our lives. There's so much information about pregnancy and all of that. But when it comes to this topic, nobody sits you down at any point in your life and says, now here's what it's like to be perimenopausal. I mean, I remember vaguely, I think my mom talking about having hot flashes. I remember my grandmother and this was when I was really young, would carry a fan around, and she didn't care who saw her with it. And I didn't know why. I thought she was just, my grandma was kind of cantankerous. And, I just thought she was, why are you carrying a fan around? You're hot. She would never talk about why, or it was what a hot flash was, for sure. But it was happening and women were going through it. And so you just don't get that conversation. So now is the time to start to learn about it, understand it, and what to do about it. So thank you for that differentiation and kind of explaining that, and for touching on the fact that it can start in your 30s, which is just it.
And some women will sail through this period and not notice a whole lot of symptoms.
Yep.
That's only about 20% or less of women. 80% of women will have some symptoms, and that varies from mild to actually debilitating.
Yeah.
And again, that's more rare. Most people are somewhere in the middle. But physiologically, what's going on is, as we age, the ovaries stop producing hormones. We stop ovulating or releasing an egg every month, and it's a gradual decline in hormones. At times, though, hormones can be secreted at higher levels, and so it can be actually somewhat unpredictable, which can cause the unpredictability in symptoms. But it's all about the decline in ovarian function and the decline in estrogen, progesterone, and testosterone, and their effect.
It can be all over the place,
Definitely.
And so I think a lot of people will say, I want to get my hormones tested. Well, from what I've read, and please correct me if I'm wrong, or what I've heard, is that, yes, I mean, you can get blood work done and have those things checked, but it's not, there's not like this number, right? That your hormones are going to be at consistently. They're going to be up and down and all around.
That's right.
And so that is not the one defining measurement of where other things you go, you get blood work done because you need to know your hemoglobin or your A1C or something else that's a predictor of something. Hormones are not that.
Yeah.
You can't really.
Yeah. Unfortunately, perimenopause with, again, it's not normal fluctuations. It's not, rather, there aren't regular fluctuations. So one day your estrogen can be this level, the next day it could be much lower. And so there aren't normal values unless you knew the exact day of your regular cycle, which is just not what is happening. In perimenopause.
That would be difficult to do. Well, and so to that point, how would someone know then? Is it just by a collection of symptoms, or maybe their periods are starting to get a little wonky? Or how do you counsel your patients on, like, it sounds like you're in perimenopause? Is it just a conversation and asking them lots of questions?
Yeah, it's a pattern that I'm now used to seeing, but I mean, generally, yes. So every woman who lives long enough will go through this.
Yeah.
And again, beginning at age 35, what happens first is we start to miss ovulation, or the release of an egg, which ovulation is required for progesterone function. So we will have months where we have lower progesterone, and those symptoms are often trouble sleeping and anxiety, panic attacks. So yes, so
I'm
that
like raising my
often
hand, like anxiety,
happens
can't sleep.
first.
Yeah.
So as far as, so it's a pattern, symptoms, and if you'd like to go into symptoms, we can talk
Yeah,
about
let's
that now.
talk about some of the more common symptoms that I think we all kind of hear about that. Again, like you said, not every woman experiences these or experiences them in a severe way, maybe even just a moderate way. But what are some of the more common ones? You mentioned not
Yeah.
sleeping. Yeah.
Yep.
Yep.
Anxiety. And then a change in your periods, which
Yeah.
is most women, I would say, have. Some women have regular periods and then they suddenly stop and never have a period again. But that would be the exception rather than the rule. So instead of a 28-day cycle, maybe a 22 to 28-day cycle, or you miss a period, and that happens, a couple times in a year. Your flow could often, it increases with low progesterone. Periods are often heavier or longer, so they last for more days than they used to. Hot flashes and temperature instability, where it may not. So a hot flash would be a sudden increase in feeling warm and actually sweating, where you can actually be drenched. Some of my patients, they have to change their clothes. So
it's happened to me in like night sweats. I know that's a little different, but I've had hot flashes where I start to sweat. Yep.
And that's related to estrogen deficiency. We will see changes in our skin. We actually lose collagen, 50% of our collagen within the first 3 years of menopause, and even leading up to that. So more sagging skin, more wrinkles. Fatigue, weight gain is another common one.
Even your body composition, I think, can change. I've heard a lot of women say that they never carried a lot of weight around their midsection, and then all of a sudden their pants won't zip. And they're like, wait a second, I haven't changed my
Weight around the
diet.
middle.
I've been, doing my usual exercise, and all of a sudden I can't zip my pants up.
Absolutely. I hear that all the time.
Yep. And they've never had that, like, just previously they never had
diet
that.
Hasn't
so
changed. Exercise hasn't changed.
And they're like, what is happening? Why is this happening to me now? Yeah.
Right.
Okay. Yeah.
Urinary incontinence becomes more and more common as we lose estrogen. Just the urogenital mucosa changes. Again, it has to do with loss of collagen and also loss of the muscular support that testosterone provides. You can get more urinary incontinence, vaginal dryness, and vaginal atrophy, which leads to pain with intercourse, and that's a really serious.
Right. That affects so many parts of your life, because then it trickles into your relationship.
Absolutely.
And how you're feeling about yourself. Yeah, absolutely.
And loss of libido. That's another very common and multifaceted symptom, not caused by one thing. Is it because I have 3 kids at home and a job and I'm busy,
exhausted,
or is it loss of testosterone?
Right.
Even things like itchy ears.
I've heard of itchy. When I heard itchy ears, I'm like, really? I don't personally have that.
Actually.
Yeah, I've noticed my skin is. I've always had kind of dry skin, but I feel like my skin has gotten dry, like more dry and a little itchy. Not horribly, but I noticed that. I have just heard that, and the symptoms can be, for me, one that I have talked to many women about is the brain fog.
I haven't touched on that. Yes.
The brain fog is real. And my sister and I were talking about this, because we were like, gosh, there's sometimes I can't get a word to come out. Like I can think it in my head, but I can't. It's like the connection is gone. And we were kind of thinking, oh gosh, is this something else? Is this early onset dementia, or is it something? You kind of really get scared a little bit, because
and that's one of the reasons we need to talk about this, because when you realize, okay, these are symptoms that can occur and are normal, and yes, I'm not getting dementia, and they can be effectively treated, especially with hormone replacement therapy. That really does help the brain fog and the hot flashes and everything that we've been talking about. But yes, brain fog can be very scary.
Right. And debilitating. You think about women, I've heard of women who were just really successful. I heard a story about a woman who's a successful attorney who had such debilitating brain fog that she was having a hard time in the courtroom.
Mm-hmm.
She couldn't, formulate sentences and couldn't, do all these things. And come to find out it was she was in, perimenopause and was dealing with that. And
here we are in our 40s and 50s at the height of our careers often, and we need our brains, and we're, taking care of kids. We're busy and productive, and brain fog can be
a really debilitating symptom. And I've talked to some women who are really trying to do a lot of work in the employment space around supports for women with menopause care. They were calling kind of menopause care and some other things. I think there's even a bill right now in California that they're trying to get passed to have more supports for women in this season having to do directly with menopause. Mm-hmm. So what are some other symptoms that people might experience with,
so I didn't talk depression.
Mm-hmm.
I talked a little bit about anxiety. That's definitely, but depression, I see more with the loss of estrogen. Okay. And it can be, again, devastating. Most of the time it is not devastating, but it's good to know that if, you are feeling depressed, perhaps it is because of your hormones, and you can get that, checked out and get that treated.
Right. And so it would be depression that maybe historically you haven't had that as something that you've dealt with, and all of a sudden you're kind of feeling more that way. Because I've talked to some women who were feeling that way and were prescribed antidepressants when they went to their doctor. But come to find out, it wasn't necessarily like clinical depression in that sense, but it was a symptom they were having being perimenopausal. So they were kind of surprised when it was like, that can be a symptom of this. They didn't realize that was part of it. So,
and I just want to say one thing. I mean, so hormones are very powerful chemicals, and they do affect every single organ system. We have hormone receptors really in every cell of our body. Yeah. But I don't want to make it sound like every problem you have when you're in your 40s, 30s, 40s, 50s is from perimenopause or menopause.
Right.
It's not. However, real symptoms do occur with the loss of these hormones. So, I mean, it is a bit of an art to tease things out. But again, I don't want to make it sound like every symptom a woman has, we're going to blame it on perimenopause and menopause.
Right.
But
still need to get things handled with your doctor if it's something else that, you've got to get addressed through a different path as opposed to this type of situation. So let's just chat briefly, if you don't mind, about, and we're going to dive more deeply into this topic in the next episode of this season. But just, in your presentation that you gave, I thought you did a really nice job of just generally covering some ways that we can address some of these challenges that we might be having. And again, to piggyback off of what you just said, not everything that you might be experiencing with your health has to do with perimenopause. And there are going to be some things you're going to do that are going to help with these symptoms, but there's not one magical thing that you can do to make everything go away. Maybe it will lessen the severity of the symptoms, might help you generally feel better overall, but it's not, you can't, there's not like a cure or a shot you can get to make perimenopause go away. This is through lifestyle changes, through hormone replacement therapy, potentially through other, acupuncture, other modalities that people can do, but just generally. So talk just briefly kind of about nutrition. And when you presented to us, you just talked about just basically living a healthy lifestyle and nutrition being a part of that. Can you just share a little bit about that?
Well, so there are some foundational lifestyle behaviors that really improve your overall health, which then in turn can improve your hormone symptoms. Yeah. So nutrition is probably number one. So just simple things like eat whole foods, try to avoid processed foods, we eat too much sugar. Try to avoid sugar and artificial sweeteners. You want to get healthy fats. So from healthy oils like olive oil, avocado oil, nuts and seeds, trying to avoid the seed oils that are really common again in processed foods. And women really need to focus on getting enough protein. We need to focus more on that as we get older, actually, to maintain our precious muscle.
Yes.
And it's hard. It's hard to get enough protein. Most women probably need 100 to 120 grams a day. And when you think about that, I mean, to try to simplify it, 30 to 40 grams at each meal, but you have to be intentional.
Right.
And, meat is a great source of protein, but not everyone eats meat.
To find it through other sources.
Yeah. So you got to get your protein. And even a very simple thing, drinking enough water. Very simple, but you want half of your body weight in pounds. You want that many ounces. So if you're 150 pounds, you need at least 75 ounces of clean water. A day. And just avoiding the junk. And then vegetables. Most of us don't eat enough vegetables. Like 5 servings a day is a good goal.
Yeah, I love that. And again, I think these are very foundational things that we all kind of know, but with busy lives, families, people eating on the go, lots of really easy fast food options, though, some of those foundational things kind of go out the window. I think it's good to just check in with yourself to say, am I getting the water in? Am I getting the protein in? Am I getting the fruits and vegetables? Am I, all of those things. It's just good to just check in with yourself on what you're eating and how much fast food am I eating, And again, I think it's a balance to you obviously don't want to, just go super extreme or anything like that.
Right.
You have to have a lifestyle and everything in
and
moderation, but yet checking in, because I think it's real easy for that nutrition to slide. That's one of the easiest things, I think, because we're just all so busy with everything that we have.
And also can I put a plug in for sitting down and eating your meals, ideally with loved ones.
Yep.
And not eating in the car, not eating on the go, and chewing your food. I actually see a lot of digestive issues, and people are just eating too fast.
Right. They're just snarfing it down really quick before they have to go to the next thing, and they don't really take time to.
And it's part of our culture. We're doing too many things at once and eating while you're looking at your phone, and just actually eat your meal.
Right. Have a conversation with the family. And that's hard. I think, especially if you have kids who are active in activities, sometimes they're not even home, let alone there to sit and eat a meal with. And so you're running them around.
You do the best you can, but try to eat meals together with your loved ones.
Even if you start just try once a week, at least try to get around the table once a week and then build it up from there, aim for 3 to 4 or 5 nights a week or something. Yeah, it's easier said than done. I know. I know people listen to me like, yeah, but you don't know. And it's like, yeah, it is really hard to do that. But I agree. I think is fiber also something that you encourage people to get?
Very important. So, and one thing that's directly related with hormones. So estrogen is actually excreted through our bowel movements. And so being constipated and having those bowel movements, sit in your body longer, you actually reuptake the estrogen that was supposed to be excreted. And that changes your estrogen level. And you don't want to do that. So fiber helps prevent constipation. And you want to have regular bowel movements, ideally 1 to 3 times a day.
Okay.
I often talk to women and they say, no, I'm not constipated. Well, how often do you have a bowel movement? Oh, once a week. No, that's constipated.
Yeah, that's constipation.
So fiber, 25 to 30 grams a day generally is what is recommended. Ideally from vegetables, whole grains, in limited amounts.
Great. Talk about movement and exercise briefly. I hear lifting heavy weights is a good thing to do for our bones, but just generally, what are some good tips on exercise?
Well, our bodies were made to move. We got to move. So many of us have sedentary jobs, which is not healthy. So even if you are sitting at a desk for 8 hours a day, well, first of all, you could get a standing desk. Or if you are sitting, get up several times an hour. So avoid being sedentary. goal of 8 to 10,000 steps per day, which is pretty easy to track. It seems like most people have a tracker.
Right.
150 minutes of cardio per week, divided up however you would like. It could be, 10 minutes twice a day. It could be 3 50-minute walks. But then you also need strength training. Again, another non-negotiable for women as we get older, and men. But we really need to strengthen our muscles or we will lose that muscle. And then it is so much harder to gain muscle than it is to maintain.
Yeah.
And again, as we lose our testosterone, we automatically lose muscle. So we
it just automatically happens. Okay.
Yeah.
We talked briefly about sleep, and you shared having a good bedtime routine with no screens, no caffeine. Can you just briefly touch on sleep a little bit? Because that can be elusive, I feel like, in this stage of life in perimenopause.
Sure. And of course, all of these things could be a whole talk on, or a whole podcast on sleep.
Yes.
But probably the most important thing is a consistent bedtime routine, which helps you train your circadian rhythm so they can work for you. So go to bed at the same time every night of the week, wake up at the same time every morning. Most people need 7 to 8 hours. Before bed, yes, avoiding screens, maybe doing some a consistent, kind of calming routine, have a cup of chamomile tea, take a hot bath, those kinds of things. You want the room to be completely dark, no lights, because if you, do wake up a little bit, open your eyes at night and you see light, that can wake you up and you may not fall back.
All thrown off.
Sleep very quickly. So blackout curtains, no alarm clocks or anything with lights.
Gotcha.
In the rooms.
That's great. Talk a little bit about stress management. Again, that could probably be a whole podcast too, but just basic kind of some things to keep in mind about our stress, because we're kind of all in different, stages, but just general stress management can be kind of challenging for people sometimes.
Well, one really important thing that I think about with stress management is avoiding loneliness. So kind of looking at your relationships, and actually one of the best predictors of overall health is healthy relationships and the strength of your relationships. Do you have people that you can lean on, that you share your life with? So just kind of taking an inventory, do you have too much on your plate? Maybe start saying no to things, or do you not have enough? Then, start reaching out. Don't isolate yourself. Join a group, find a community, with common values or hobbies. Right. So that's really important.
Absolutely.
And things like, I'm a huge proponent of meditation. I think that's, and there's a lot of research behind what that can do to help manage stress and different parameters like blood pressure, cortisol level.
Excellent. You also practice acupuncture.
I do.
Share a little more about acupuncture, kind of what it is and how it could benefit anyone.
Yes.
Not just people in perimenopause, but how does it help?
I just got back from the annual American Academy of Medical Acupuncture. Oh my gosh. It's always very inspiring. So acupuncture basically helps your body heal itself through the regulation of the normal energy pathways throughout the body. There's lots of other ways acupuncture actually works in the research that they've done, but what acupuncture can do and how it's directly related to stress management is it helps reduce vagal tone. It helps the autonomic nervous system kind of moving from the fight or flight to rest and relaxation. So really helps sleep, anxiety, mood, and hormone balance. Then it does lots of other things. Like it's wonderful for almost any type of pain, headache, joint pain, any kind of pain.
It has a wide application then, it sounds like. Okay.
But also psycho-emotional issues. It can help. I mean, it can help allergies, gut issues. I mean, it's a pretty broad application to most things in healthcare, really. But I use it a lot in menopause, mood, pain, sleep.
All of those things.
Yes.
Sounds Excellent.
And it's very effective, and I mean, basically no side effects. And sometimes, I mean, I will see results immediately often.
Okay.
For best results, if it's a chronic thing,
you
do require multiple treatments.
Right.
For acute issues, I mean, 1, 2, 3 treatments often will take care of it.
We'll take care of it. Wow. Yeah. That's excellent. We're gonna dive more into that in the next episode for sure, because I want to learn more about that. Well, we have a lot of other deeper dives to do on these topics, but before we end this episode, can you touch base on hormone replacement therapy? And we're going to do a specific episode on this topic, but just really briefly, can you share just about that as a possible treatment for the symptoms of perimenopause and menopause?
Yes. Okay. So hormone replacement therapy replaces estrogen, progesterone, and testosterone that you're losing during perimenopause and menopause. And absolutely is, in my experience, the number one way to treat these symptoms and I hear over and over again from my patients, I feel like myself again. It's basically getting your levels back up to, something, more like early 30s, not the levels of when you were 20, but to where you don't have the hot flashes, you're sleeping great, if your symptoms were related to hormones, if they weren't related, then the hormones aren't going to help, but it just helps get you feeling like yourself again in the short term. But then I'm sure later we'll talk about all the long-term benefits. And it's safe and it's effective. And again, in my experience, more than, any supplements, it's very effective.
Very effective. Yes. So the third episode of this season is going to be completely focused on hormone replacement therapy. We'll dive into it. We're going to talk about the WHI study as well, because that unfortunately was a source of a lot of fear and misinformation to healthcare providers and to women over the years. We'll dive into that, and we'll talk about specific hormone replacement therapy modalities and different ways to go about that. And I know a lot of folks will be wanting to know about that. So thank you so much for going through all of these things with us. We're going to do a deeper dive into some of these lifestyle things in the next episode. So I can't wait for that. Thank you so much.
Thank you.
If you're enjoying the podcast, please follow the show to make sure the latest episode is on your podcast feed each week. I would greatly appreciate a rating and a 5-star review on the podcast platform you're listening on. It helps others to find the show. If there are topics you'd like me to discuss on the show, please email me at themarvelousmiddleagepodcast@gmail.com or direct message me on Instagram @Nicole Stute. Thank you for listening.